Okay, perfect. So what I want you to do for this question, since this is our first question we're doing together, I want you to read out loud how you would think about doing this question originally, and then after you kind of go through the whole question, then I'll kind of tell you how I want to do it, so you can compare and contrast.
Okay. Normally, so my strategy so far has been to read the question first.
Okay.
So I'll go, which of the following factors is most likely to contribute to the development of this patient's conditions? So this is where I start to like have inconsistencies. Sometimes I'll take a peek at the questions, I mean at the answers, and then sometimes I don't. But like what I'm doing right now, I already see decreased colon motility, so I know it's like a GI issue. And then
Okay.
so and then I go up to and I start reading and picking out important stuff. 58-year-old man. So I'm just noting the age, history of obesity, type 2 diabetes, presents to physician with intermittent cramping, abdominal pain, make note of that, changes in bowel habits for past 6 months. I know it's been 6 months. And then alternating constipation, diarrhea, family history negative for colon cancer, physical examination, vitals are stable, abdomen is soft and mild tenderness in left lower quadrant. Definitely note left lower quadrant. And colonoscopy reveals multiple small pouches in sigmoid colon. It's important there. Which of the following, again, questions. And then now what I'm thinking is probably small pouches. It's if I remember diverticulosis, diverticulitis, doing along that line. And then left lower quadrant, so it's in the sigmoid colon, so it's more concentrated in that area there. There's no family history of colon cancer. And then now I'm looking through the questions to see if the answers, if I can see if I can relate to that. Decreased colonic motility. No familiar adenomatous wow, I can't even say it. Polyposis, high fiber diet, increase intraluminal pressure, inflammatory bowel disease. I'm thinking familial adenomatous polyposis.
Okay.
Um,
All right. So now I'm gonna kind of walk you through how I would think about this, and we'll kind of compare and contrast. Okay. So, first, kind of exactly what you're doing here, which of the following is most likely to contribute to the development of the patient's condition. So, I'm thinking it's a risk factor question that's automatically in my mind. I skim through the answer choices and I think, okay, this is definitely a gastrointestinal or GI question. Then I'm going to read, which I've highlighted already, but things that are clinically important. So, you have an older age man, 58-year-old male. He has a history of obesity and type 2 diabetes that's important for a risk factor. He has intermittent crampy abdominal pain. So, it's intermittent, right? And then changes in bowel habitus for the past 6 months. So you know in your mind, you have to think: is this an acute or chronic issue? So I know this is a chronic issue that happens every so often where he has abdominal pain. Okay, he reports alternating constipation, diarrhea, so he has fluctuating in stool consistency. Family history is negative for colon cancer. That's super important, meaning that anything that has high risk for colon cancer should not be your answer. That's already thinking in my head. On physical exam, his vitals are stable, his abdomen soft, mild tender in the left lower quadrant. So overall, his abdomen exam is pretty normal, but some mild tenderness in the left lower quadrant. So that's kind of where your sigmoid is. Colonoscopy reveals multiple small pouches in sigmoid colon. So definitely for sure, I'm thinking in my head, diverticulosis. Okay, diverticulitis, right, is inflammation, right? And usually you're going to have fever, chills, very bad abdominal pain, right? That's an acute infection, right? So this is diverticulosis because he doesn't have, really bad issues right now, right? Which just means multiple outpouching. So already in my mind, you have a diagnosis, which you got right, which is diverticulosis. Now you want to ask yourself, okay, what risk factor can increase your chances of having diverticulosis? Okay, that's what's going on in your mind. Okay,
got it.
decreased
Yeah.
colonic motility, and maybe, right? Familial adenomatous polyposis, right? That means polyps, which are different than diverticulosis, which is outpouching. Polyps are actually,
Gross.
little lesions within the lumen, right? And remember, familial adenomatous polyposis can increase your risk of colon cancer, right? So
Mm.
unlikely that high fiber diet that actually should help because you're going to be able to pass stool better. So that shouldn't lead to diverticulosis. Increase intraluminal pressure. So the more intraluminal pressure you have, that should weaken the walls and create outpouching. So that's high on my list right now. And inflammatory bowel disease. Well, he doesn't have, he's too, first of all, Inflammatory bowel disease is an autoimmune disorder. So usually you're going to catch that younger, right? So in your 20s and your 30s. So he's outside that range for a first diagnosis. Also, if it's Crohn's or ulcerative colitis, right, you either have ulcerations or you have, multiple issues that go on with inflammatory bowel disease. So really what I should be looking at is these two answer choices here: decreased decreased colonic mobility, familial adenoma, or increased intraluminal pressure. So these two are the things that I'm thinking about. So in medicine, I never talk in absolutes, and you'll notice this when I go through questions with you. I would say that on a test taking strategy, my most likely answer would probably be increased intraluminal pressure, because in my mind, I think that's the most direct cause of diverticulosis. Decreased colonic motility can increase a little bit of the risk for diverticulosis, but I think this is a better answer. So if I were to put odds on it, if you're a betting man, I would say I'm 60 or 70% sure that is the answer is D.
Got it. Okay.
Okay. Okay. Does that make sense? Kind of how I'm working through questions?
Yeah. So the very first thing you did was like you kind of assess what kind of question it's asking, right? So you said this is a risk factor question.
Yes.
Um, I'm sure we're gonna go through more reps and then figure out what types of questions and things like that. But like, is that what you're already looking for so that you know what category of like thinking that you should be in?
Yeah.
Because
In,
like
in a
whenever I read
sense,
that, I had no idea what to think there.
sure. Yeah. In a sense, right? Like, there are limited I know this sounds weird, but there are limited ways that they can ask you a question. Okay, the more reps that you do, you'll start to notice a pattern. I'm going to just throw a couple out at you that are very prevalent. So when they ask about associations or factors, they're talking about risk factors, right? Like what is associated with the disease. That's just another way of saying, you know um, what can lead to this disease, which is just a risk factor. They can ask you, what is the diagnosis? That's a very easy one, right? That's just a diagnosis question. Or what is the mechanism action of this diagnosis? Meaning it's a second order question. So you have to figure out the diagnosis and then figure out how that happens, right? That's a very common. Or what is the treatment for this diagnosis? Meaning it's some kind of medication question, right? So there's
Mm.
very limited. There it's not as much as you think. You get what I'm trying to say?
Yeah. Okay.
The categories are pretty small, but don't overthink it. Once you start seeing that pattern, it'll click a lot easier for you, so you don't have to overthink it. I'm just trying to speak out loud of kind of how I'm thinking so you can kind of get into my brain, if that makes sense.
Got it. Okay.
Okay, questions, concerns about that. So remember, familial adenomatous polyposis. So because you spoke, your actually logic is actually pretty clear. I would say there's a little bit of hesitation here and there, but I'm going to tell you this, right? It's clear enough where I can say, okay, so where you went wrong. So when you're reviewing this, where you went wrong in this question is that you got the diagnosis correct, but then all of a sudden you switched the diagnosis, right? You said it was diverticulosis, and then you chose an answer that causes polyps, which are two different diagnoses. Does that make sense?
Yes. Okay.
So I would say that I like what you're doing, and you're committing to a diagnosis, which is diverticulosis. So then you got to pick an answer choice that supports your diagnosis. Don't switch it.
Got it. Okay.
Okay. All right, let's go to the next one together. And I want you to try it kind of a little bit more my way here.